Recognizing early signs of dementia, a family's guide to awareness and action. Dementia and cognitive decline can feel like a heavy topic, especially for families with aging loved ones. It's natural to feel uncertain or even overwhelmed when these changes start to surface. However, early recognition and proactive steps can make a meaningful difference. This video is here to guide families in understanding dementia, recognizing its early signs, and taking action. Because when it comes to brain health, awareness is the first step toward empowerment. Dementia is more than just occasional forgetfulness due to aging. It refers to a decline in cognitive abilities, such as memory, reasoning, and communication, that interferes with daily living. While dementia affects many families, it's important to note that it's not a normal part of aging. There are various types of dementia, including Alzheimer's disease, which is the most common form. Others include vascular dementia and Lewy body dementia, each with its own unique characteristics. Spotting the signs early can make a significant difference. It allows families to consult healthcare professionals, explore treatment options, and make plans for a supportive environment. Early detection can change outcomes by enabling therapies or interventions that may slow progression and improve quality of life. Understanding what to look for is the first step to helping a loved one. Subtle changes might often be dismissed as normal aging, but they could indicate early cognitive decline. Common warning signs include forgetfulness beyond normal. Everyone forgets things now and then, but forgetting appointments, repeatedly misplacing items, or asking for the same information over and over can indicate a deeper issue. Difficulty with familiar tasks. Struggling to complete daily tasks like cooking, organizing groceries, or managing household finances can be a red flag. Confusion about time or places. A loved one might forget what day it is, lose track of time, or even feel disoriented in familiar surroundings. Language struggles. Finding the right words to express thoughts, losing the thread of a conversation, or relying on vague terms rather than clear descriptions are common signs. Mood and personality changes. Increased irritability, depression, anxiety, or sudden outbursts can hint at cognitive shifts. Also, withdrawing from social activities or hobbies could indicate a need for emotional attention. Difficulty making decisions. Hesitating over simple choices, such as picking clothing or becoming increasingly indecisive, may signify underlying cognitive challenges. Pay close attention to these behaviors, especially if they occur frequently or worsen over time, and document them for better clarity when consulting healthcare professionals. When you suspect your loved one is facing cognitive decline, it's essential to approach the situation respectfully and thoughtfully. Here's how families can take practical steps. Observation without intrusion. Focus on what they can do instead of what they struggle with. For example, monitor how they handle daily routines like cooking, cleaning, or managing medications, but do so discreetly to avoid undermining their confidence. Gentle communication. Avoid pointing out mistakes directly. Use prompts or gentle reminders instead, creating a positive environment where your loved one doesn't feel overly criticized. Document behavioral patterns. Keeping track of changes in behavior or memory can help provide a complete picture to healthcare professionals when it's time to seek advice. Subtle support can go a long way in making your loved one feel safe and respected during this process. Helping your loved one maintain cognitive health is not only possible, but can also be a fun, family-inclusive effort. Engaging in memory-boosting activities together strengthens their brain function while creating cherished moments of connection. Consider these options. Puzzles and brain games, crossword puzzles, Sudoku, matching card games, and other structured activities challenge the brain while keeping the mood light and enjoyable. Storytelling sessions. Encourage your loved one to recount family stories, share childhood memories, or describe familiar traditions. It's a powerful and meaningful exercise for recalling past events. Creative hobbies, crafting, drawing, painting, or learning a new skill keeps the mind stimulated. Even introducing new recipes or gardening can be surprisingly effective in keeping the brain engaged. Physical activities, walking together in nature, or trying simple dance routines integrates movement with mental engagement, which greatly benefits overall brain health. These activities provide mental stimulation and emotional enrichment, benefiting both your loved one and the entire family. One of the hardest parts of addressing dementia or cognitive decline is discussing safety concerns. Loved ones may resist or feel misunderstood, making these conversations challenging. However, viewing them as opportunities to protect and preserve their independence can shift their tone from conflict to collaboration. Why safety planning is crucial. As cognitive decline progresses, tasks such as driving, managing medications, or cooking can become risky. Having early conversations ensures the right precautions are in place when they are needed. Tips for navigating tough discussions. Choose the right setting. Have these talks in a calm, private space where they feel comfortable and safe. Lead with empathy. Use compassionate language, acknowledging their feelings first. For instance, "We want to ensure you're safe and happy, no matter what," can provide reassurance. Provide choices. Instead of making decisions for them outright, offer options wherever possible. Involving them in solutions can decrease resistance. Examples of safety topics to address. Driving limitations. Can alternative transport be arranged safely? Medication management. Would pill organizers or reminders help reduce errors? Home safety adjustments. Adding grab bars, removing trip hazards, or modifying living spaces to prevent accidents. Approaching these discussions with care and involvement reinforces trust within your family and ensures dignity is maintained. When cognitive changes are noticeable, it's time to involve a healthcare professional for a thorough evaluation. While there may not always be a simple diagnosis, early intervention increases the chances of managing symptoms effectively. Medical assessments to expect. Doctors may perform memory tests, neurological exams, brain imaging, or blood tests to determine the cause of symptoms. Encouraging your loved one to attend these appointments with a trusted family member can make them feel supported. Treatment and intervention options. Medications may help slow down symptom progression for some forms of dementia. Cognitive therapies focusing on memory techniques can boost mental endurance. Lifestyle changes like incorporating a brain-healthy diet, rich in berries, leafy greens, and omega-3s, regular exercise, and sleep hygiene can improve overall well-being. Therapy benefits. Counseling can help your loved one cope emotionally, while family members benefit from caregiver support or group therapy. Physical or occupational therapy may also play a role in maintaining mobility and independence. Early medical intervention doesn't reverse dementia, but it does pave the way for better management and improved living standards. Once a diagnosis is confirmed, supporting a loved one becomes an ongoing process. Families can thrive through this journey by preparing for changes together. Family care plans. Develop a roadmap for care during different stages of the condition. This could include delegating caregiving tasks, planning for assisted care, or legal and financial preparations such as power of attorney. Caregiver support. Recognize that dementia impacts caregivers as well. Emotional resilience is key, so don't hesitate to lean on support groups or professional resources for guidance. Open communication. Keep channels of communication open within your family, revisiting conversations as needed. Check in with your loved one often to ensure their feelings and needs are considered throughout the journey. With thoughtfulness and teamwork, families can create a nurturing environment that respects their loved one's dignity and well-being. Dementia and cognitive decline impact entire families, but awareness and early action make all the difference. By recognizing the early signs, offering meaningful activities, addressing safety concerns, and seeking professional advice, families can build a supportive framework for their loved ones. The journey will have its challenges, but with preparation and compassion, families can foster an environment where their loved ones feel respected, safe, and cared for. Let this video inspire families to start conversations, take practical steps, and come together to support the well-being of their beloved family members. Together, we can ensure no one faces this journey alone. Start today, because early recognition is the first step to making a brighter, safer tomorrow for your loved ones.